Hello, I'm Lee Bernick, and I'm Dean of the Greenspan College of Urban Affairs, and I want to welcome you to another edition of the Urban Report. Today, we have with us Dr. Peterson, Colleen Peterson. She is the director of the Center for Individuals, Couple, and Family Therapy. And Dr. Peterson is also a member of the faculty in Marriage and Family Therapy. She has her degree from Brigham Young and her PhD from Kansas State University. So she's been around, but she's been here for a number of years as the director of the center. And I want to talk to you about the center. And the first question is, why such a long name? Let's talk about this, individual, couple, and family counseling.
Yeah, I think the main reason behind the long name is we want to make sure that people understand the kind of services that we provide, both to the individuals as well as couples and families.
So what's the distinction, though, between individual therapy and couples therapy or family therapy? Is there a distinction?
Yeah, I think the primary distinction between those is the modality that we're using. And when we're doing couples or family counseling, we're actually treating the couple and the family and involving all of them in the process rather than working with individuals.
But when we talk about a family, we may be dealing, do we only deal with the family then, or do we deal with individuals within the family, or what? I mean,
yeah, when it comes to the couples and the families, our students are really trained to work with both the interpersonal aspects, so what's going on between people, as well as what's going on with the individual. So there may be times when they're working with couples or families when they would see an individual for a period of time or a session or a part of a session. But really what we found is that working with those people together who are involved in whatever the situation is or what the challenge is that they're facing, we really get the best results.
Okay, and so you mentioned about the students. So who staffs? You want to explain who staffs the center and how that all works?
Sure, you bet. The services provided at the center are provided by the graduate students in marriage and family therapy as well as the doctoral students in psychology. And then they are supervised by the marriage and family therapy or the psychology faculty. So they're always being supervised by someone who is licensed or has a doctorate in a mental health related field.
And so these are graduate students.
Yes.
And I think, as I understand, they have to do this clinical work. I mean, this is their clinical
Right,
work.
yes. Both the marriage and family therapy degree and the clinical psychology degree are clinical degrees. For the marriage and family therapy students, they have to actually have 500 face-to-face client contact hours as part of their training for their master's degree.
500 hours seems like a long time. Is that?
It is.
It's a long time. Is that over how many weeks, months, semesters?
Typically that's over 5 semesters, so about a year and a half they're involved in that intensive clinical experience.
And how many, well, I was going to ask you how many patients, if you will. Is that the correct? What we would
clients
say?
Is what we call them.
You call them clients. And how many clients does a student actually work with at any one time?
Yeah, typically, if we talk in terms of cases, because some of them are more than one client with a case, the students carry anywhere from 5 to 8 cases at a given time when they're doing their practicum in the center. When they move out and add time in the community doing an internship, they may see 10 to 12 out in the community as well as 2 or 3 in the center.
Okay. So they see 5 to 8 clients. Maybe 2 or 3 cases, maybe 5 cases then, right?
No, it would be 5 to 8 cases.
5 to 8 cases, but in some sense, some of those cases, if they're couples, they're actually seeing, you know, 2 people.
And if they're a family, there could be up to 6.
Up to 6 people, okay? And when they see them, how long is a session?
We work on a 50-minute hour.
Okay. So an hour is not an hour, it's 50 minutes.
50 minutes, yeah, which is the standard of practice within the mental health profession.
Okay, and it just goes on that whole time. Do they, how do they prepare? I mean, if I go into a doctor's office, you know, I'd like to think that the doctor knows something about me before they start, prescribing things. What happens? How does the whole process? Can you walk us through from start towards hopefully the end of a case?
Sure, you bet. If a client's interested in services at the center, what they do is they call the center, and one of our assistants fields their call. We do a preliminary, what we call a phone intake on the phone, to make sure that we get an idea of what their presenting problem is, make sure that we're going to be able to provide services for them, because there are some things that we're not able to do. We don't prescribe medications. If they're actively suicidal and need more support than that, we don't see those clients as well. But then basically, once we've determined from that brief phone intake that they're somebody that we can help, then we set up what we call an intake interview. It's a preliminary screening just to get a better sense of what their situation is and what they want help with.
Okay, so you do this intake to get a sense of what they're look like and in terms of what the issues are. And screen. Now, who does the intake? Does the student?
The students do the intakes.
So students learn how to do the intake? Is that important?
Correct. Yeah, so it's basically kind of a brief psychosocial history, and then we also screen for substance abuse, domestic violence, as well as if there's a potential harm to others.
Okay. And this screening, is there a protocol? I mean, is there a form?
Yeah, we actually have what we call a structured intake interview, and they go through and ask very specific questions to gather that information.
Okay, and then part of their training is to learn what to do with the intake interview.
Right, so we train them to do those intakes, how to assess the information.
The assessment question.
Right, and then during the process of that intake, they will actually come and speak with one of the on-site supervisors or myself as the director to make sure that they're appropriate for services before we accept them as clients.
All right. But the person who does the intake doesn't necessarily do the therapy.
Correct.
So somebody, they're in there learning how. Is that part of that 500 hours?
Yes, those intake hours count toward their 500 hours.
So they're learning how, just like a doctor would initially in a hospital or anything else do a history. They're doing a history of the patient or the client.
Correct.
And then they go over it with one of the faculty members. How often do at what point and how often do the faculty members get involved in that part? And we'll talk about the other part, but do they say, no, you're wrong? Is this?
Yeah, I'd say maybe 1 or 2% of the time we find a client that we really can't provide the level of services that they need. But pretty much we take the clients when they come in. Okay,
so they do this intake interview. They decide what the issues are. Or believe they are, and then they're assigned. Then the client is assigned to a student for therapy, right?
Correct.
Now the faculty who are supervising never really do the therapy.
No, on a rare occasion they might do co-therapy with a student, or we've had times when they've done what we call a reflecting team. But typically they're either reviewing the videotapes, because all of the sessions have to be recorded so that the supervisors can observe what's going on in the actual therapy rooms to facilitate the training of the students, and then or they can watch behind the one-way mirror, because we have 6 rooms that have one-way mirrors.
And so the clients understand that this is all being taped.
Right, that's a part of their informed consent when they first come in, and they agree to that to be seen at the center. Okay,
so a client comes in, they do an intake, we do this assessment, they're assigned to a student for therapy. And therapy lasts 50 minutes or so. How long can people, what's the typical range of number of visits that
Yeah, I mean, a lot of it has to do with the presenting problem. We'll have clients that come in, a standard treatment, one would think for a basic kind of couples issue might be 8 to 12 sessions. You might have some clients who have more severe anxiety or depression, and they might go for 30, 40 sessions. It really depends on what it is that they're coming in for.
30 or 40 sessions. It's a long time.
Yes.
How many times a week? When you say 30, is that 30 to 40 weeks, or is
yes.
that? So they typically come once a week?
Yes, they do.
They come once a week. And you talked about the kinds of problems. You mentioned depression and anxiety, and what's the range of kinds of of issues, and what are we dealing with, or what are the students dealing with in those?
Yeah, I'd say there's really a broad range of presenting concerns, anywhere from child behavioral problems, marital difficulties, all the way up to some of the more severe things like the depression or the anxiety. I was just reviewing prior to our meeting today some of the presenting concerns and the frequency, and anxiety and depression and stress were the highest presenting concerns.
Now, for the anxiety and depression, is that more likely to be something that the couples or an individual, or what's the difference in terms of, we have these individuals and then we have these couples and then we have families. What do we typically see in each of those categories? Can we talk about that? Is that possible?
Yeah, I guess what I would say is that it like depression, you'll see it in an individual, but you also have times when, for instance, let's say there's unemployment and someone's been unemployed for a long time. They may be experiencing depression, but it's having a ripple effect on the relationship. So you'll see those kinds of things in couples therapy as well.
And I know that recently, in the last year, we've been doing more of the issues you talked about, losing a job and anxiety and couples and everything, that we started a program specifically for that. Can we? Yeah,
right. The marriage and family therapy program, we recognize, particularly here in Vegas, that we have a strong, we have the highest unemployment rate in the country, and we recognized that several months ago. And so we actually went into the literature, found out what was best in terms of working with individuals and couples and families who are facing those issues, put together kind of a little mini treatment module for our students to help them understand what those needs are and how to work best with those clients. And so we began that project for that specifically.
And do we have any sense of how that's working?
It's actually working fairly well. We've seen an influx in those. I mean, I would probably say right now, the new cases that we have coming in, I'd say 50 to 60% of the people are dealing with financial or employment stressors.
Okay, so that they come in, and without mentioning, so what do we do with the family? I mean, I've lost my job. You're not finding me a job. What are you telling me about this whole thing, right? I mean.
Yeah, I mean, the basic things that we work with clients in those kinds of situations are we help them deal with stressors and how to find coping skills to manage that. One of the things that we've seen an increase of is domestic violence, child shaking, those kinds of things. So really helping them learn how to monitor that stress so that it's not impacting others around them.
Okay, so one of the important things that you just mentioned, what I understand is that, so when an individual loses his or her job, they're under stress, and what you're saying is that has this ripple effect, as you say, with the rest of the family, including, and you mentioned this, and I think that, as I understand it, we've seen an uptick in the issues of child abuse, or is that right? I mean, that many times the parent is just letting out their frustration on the child, using the child. And so what's a typical kind of coping skill that you try to talk to them about?
We'll teach them deep breathing and relaxation techniques. We'll really focus on them for really monitoring how they're feeling and increasing their awareness, those kinds of things.
And have you had feedback from people who have been in the program about that? I mean, do people come back to you and say, gee, thanks, I mean, it's worked, or do they? Yeah,
actually we do. We do a little bit of a satisfaction survey when clients finish up. In fact, I got an email last week from a client that just said, we just want you to know we really appreciate the work and the service that you all provide. And I think in a lot of ways it's because we really are an amazing service in the community, because we are low cost and we really provide services to those who couldn't afford them elsewhere.
Okay. Well, I want to talk about the cost thing, but we'll get back to that again. Okay. But so we've done things with people who have lost their jobs and how the family is involved in that. Are there some other examples that you can give us about the kinds of things and treatment that the students face and deal with? on this?
Sure, you bet. I think one of the cases that really affected us, or we realized the importance of the work that we do, was a case that we had of a mother who was facing end-stage cancer and who had 3 young children. And so we were able to bring this family in and give them an opportunity to process and think about and handle how they're going to deal with, the mother's eventual passing. And it was, this was a particular situation where, there was unemployment involved as well. The family had actually been kicked out of their home because of a foreclosure, all those kinds of things. And those were stressors, and the parents were just so grateful that we were able to provide services for them, because if we hadn't been there, they wouldn't have been able to have those services.
And so the students were there and providing the therapy for this. How do they, let's talk a little bit about the students and they're providing therapy. And one might say, well, gee, why should I come to the clinic? These are students, is it real? And how do we, how does that work? And at what point do we feel confident enough to let the students in there to do the therapy?
Right. Yeah, I can speak to the marriage and family therapy students. They actually have a full 2 semesters of coursework prior to their being able to even see clients. They learn the basic techniques and those kinds of things, and we wouldn't allow them to start seeing clients unless they were ready to do that. But where I rest assured in the quality of the services that we provide is that we as supervisors, we review their videotapes with them, we observe through the one-way mirror, and so we have a very precise way of looking at those skills, and it's not just them saying, oh yeah, I did this great work. We're actually able to observe the quality of the services that they provide.
Okay, but so let's say I'm a student, I'm assigned a client.
Mm-hmm.
So I get their intake information. Do I come to you or somebody and say, okay, what's the typical kind of modal services that I provide?
Right. So what happens is all of our students are in a practicum, which is basically group supervision for 2.5 hours a week, as well as they get 1 hour of individual supervision a week. So let's say I'm the supervisor with a student who's got a new case. The student comes to me, they say, okay, I have this new case, this is what's going on, and I actually walk them through what we call a case conceptualization, where we'll look at what the presenting concerns are, what the goals for treatment are, and then basically based on the research according to that presenting problem, we'll set up a treatment plan for the client and how to help them move toward those goals.
And it's usually successful or
Yeah, usually.
Usually. How do students get graded? I mean, they're not graded by, in a sense, their grade must be the process of doing this, not whether the person comes out successful.
No, their grades are based on, we actually have what we call competencies. And there's a whole rubric of what our expectations are for them. It's how they manage the session, how they interact with the client, how they're able to develop a treatment plan, how they're able to follow through with the treatment plan. Those are the kinds of things that we look at with their grading.
Okay, but we don't say you can't pass the course unless these people.
No, it's not contingent on the client's success.
It's the client's success, but do we have a sense that it's successful or not? Though?
Yes, we do.
Right, and what do you have a sense of how the students feel about all of this? I mean, they're in there, and let's take for example. Sometimes people go into student. They want to be a teacher, and they go into student, and they go through their training and they say, gee, I don't want to do this.
Right.
Do we find that we have some students once they get into the therapy, doing the therapy, that they say, gee, this is not for me?
Yeah, we have some students that kind of self-select out. I think I've seen it maybe 2 or 3 times in the 11 years that I've been here at UNLV.
But most of the time when they enter the program, they're committed to it, and stay with it.
Yeah, they're committed to it, and we also have a very intensive screening process prior to even admitting students. And we have the potential candidates come in for a day-long interview. We do group exercises with them. We have them do mock therapy session and interviews with the faculty. So we have a really good sense of their interpersonal styles, their goals, those kinds of things. So we're looking at a fit prior to them, even being admitted to the program.
Okay. And where do the students go after they complete their degree? I mean, what do they do? I mean, we think of family therapy, and you and I have talked about this before, of people just, we're not talking about people living in California dealing with stars or something who can't get along. I mean, what do they do when they leave the program?
Yeah, typically most of our students are involved in some kind of agency, community agency kind of work. Part of it is they need to develop their reputation within a community and a referral base, and then a lot of them move into private practice.
They will move into private practice.
Most of them do.
Okay, and but that's after they've been licensed on this. To get a license, you have to get your degree. You
Right.
have to have this 500 hours, and you do some other therapy afterwards.
Right. Before they can become licensed, they actually have to have 3,000 hours of experience before they're licensed to practice independently. They'll be licensed as an intern, but in order to practice independently, they have to have 3,000 hours of experience.
Now, are all the faculty who supervise licensed?
Yes, they are.
So we have all licensed people supervising our students and watching and giving feedback to the people, so that when people come in, they can be assured that they're getting really sound treatment and therapy in the clinic.
Yeah, all of the marriage and family therapy faculty, not only are they licensed, but they also have expertise in training as supervisors as well.
As supervisors. And so we have this wide range of people coming in, and there's no age restriction. I mean, could people who are 21 come in? Can people who are 85 come in? We don't put an age restriction.
No, there's no age restriction. I think I looked at the demographics of the clients. We have clients that are young, that are 4 or 5, up to, I think the highest number I saw was we had an 82-year-old woman who was coming in.
An 82-year-old woman, and an individual basis, not a couples.
No.
No. And do we give them somebody who's in their 80s that might come in? We don't tell them, well, you ought to get married or you ought to get divorced. We're not doing any of those kind of.
No.
No. Okay. So we have this wide range, and you talked about the cost. Let's just spend a minute on the cost factor in this thing for people.
Okay. The center's policy is that we charge $25 a session, but our policy is that we don't turn anyone away because of an inability to pay. So we have a sliding fee scale that's really based on poverty levels, poverty numbers in terms of size of family and income. And so we'll slide down to $1. What we found is that the research shows that if clients are paying at least something, they're more committed to the treatment. So we try to have them at least pay $1. But for UNLV students or students that are in the Nevada system of higher education, they receive services free at the center.
So a student can come and they would receive services free. Well, let's see if we can get the phone number for so that if people want to call. Let's try to get we have the phone number there, 895-3106, right? And they can call and make an appointment there.
Correct.
And the center is on campus, and if we can get the map up and show there's a highlighted building in red. That's the MPE building, and it's on Harmon Avenue.
Correct.
Right? You come down Swenson and turn into the campus on Harmon. And the MPE building would be on the left-hand side as you're driving into the campus, right?
Correct.
And there's parking there. What time is the clinic open? When can people come to the clinic?
The center is open Monday through Thursday from 4 to 8 in the summers and 3 to 9 during the regular school year, the fall and the spring.
From 3 to 9 during the school year. 4 to
8
8
in the summer.
In the summer, Monday through
Thursday.
And how difficult is it for people to get into the clinic? And
Right now, we don't have a waiting list for couples and families. We do have about a 2 or 3 month waiting list for individuals.
okay, but if a family or a couple needs some help, they should contact us.
Yes, definitely.
We're interested in helping the people in the community. How many people have we helped in the last year or so, do you think?
We have had about 357 cases in the fiscal year 2009, and we saw about 3,400 sessions in that year.
Over 3,000 sessions, you know, close to 3,500 sessions in the year. 300 and some families or people, right, cases
Yep.
in there. That's a pretty impressive kind of service that we're providing to the community. And it does a number of things, as I understand. One is we're providing direct services to people in the community who normally could not necessarily get those services.
Correct.
And we're training students, right? And it also helps for the faculty in terms of that. So, you know, I think the clinic is a great place, and I want to thank you for coming in to talk to us about the clinic. If you have some issues, if you think you have some issues, to contact the clinic, again, it's 3106, right? 895-3106. If you have any questions, please contact us. If you have some issues with the report, the urban report, or if you want to ask us any other kind of issues about marriage and family therapy independent of the clinic, you can contact us at leebernick at UNLV.edu.